Hi, everyone. I'm Pragya Verma, and my colleague Alex Battaglia and I work in the Research and Evaluation Group at Public Health Management Corporation. Our presentation focuses on a school-based youth tobacco education intervention program developed by the American Lung Association called Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health, otherwise known as INDEPTH. INDEPTH is not a cessation program. Instead, it aims to educate youth about nicotine dependency and addiction. It employs an alternative to suspension model where students who are caught using or possessing a tobacco or nicotine product will have the option to complete INDEPTH in lieu of facing a punitive consequence, such as in-school suspension. The 2019-2020 school year was the first year that INDEPTH was fully implemented nationally after a brief pilot evaluation conducted in the spring of 2019. The first key finding was that 52.3% of students reported an increase in their motivation to use tobacco products less. The second key finding was that 64% of students reported that they had already taken steps to reduce their use or had quit tobacco altogether. Now I will turn it over to Alex, who will discuss the results from our evaluation in more detail.
Okay, thanks, Pragya. To talk a little about the survey sample size, we had a total of 91 post-program facilitator responses and 375 student responses from the 2019-2020 school year, despite programs being halted in March 2020 due to COVID-19. As we mentioned, one key finding from the in-depth student survey was that almost 2/3 of all students, 64%, reported having taken steps to reduce tobacco use or had quit altogether. This is shown in the graph as the dotted black line. However, from a health disparities angle, this average was not representative of all racial and ethnic groups. Students who identified as Hispanic, Latino, Latina, Black, African American, and Pacific Islander Hawaiian Native experienced lower averages than other groups, which include American Indian, Alaskan Native, Asian, and white. This is shown by the yellow dots. To compare the in-depth study to national data sets, we also stocked the in-depth racial and ethnic breakdown as indicated by the blue bars in the graph to the National Youth Tobacco Survey, or NYTS 2019 data, which is indicated by the maroon bars. Percentages in each group represent the distribution of youth who reported having used tobacco products in the past 30 days, separated by race and ethnicity. We found that the tobacco use rates between in-depth and NYTS, when broken down by race and ethnicity, were similar for American Indian, Alaskan Natives, as well as for Pacific Islander Hawaiian Natives. Youth tobacco use was much higher among Black, African American, and Hispanic, Latino, Latina youth in NYTS data compared to in-depth. In-depth sample had an overrepresentation of white students compared to the NYTS dataset, which is a nationally representative dataset. In-depth sample also had an underrepresentation of minority populations, including Asian, Black, African American, and Hispanic, Latino, Latina. And now I'll pass it back to Pragya to talk a little bit about the recommendations.
Thank you, Alex. Future implementation and evaluation of INDEPTH aims to increase participation in the program and to build a nationally representative sample to better address youth tobacco use health disparities by race and ethnicity, which Alex just presented on. In the 2020-2021 school year, in-depth evaluation has also shifted to a pre-post assessment to better measure tobacco use change over time, as well as motivation and confidence to quit before and after the program. This evaluation would not have been possible without our American Lung Association partners, Michelle Mercure, Molly Ryan, and Nick Sarita. Thank you for viewing our presentation. We hope you enjoyed learning more about INDEPTH and its impact on youth tobacco use outcomes. To learn more about the American Lung Association's INDEPTH program, scan the blue QR code at the bottom of the slide. And if you'd like to learn more about the Research and Evaluation Group at PHMC, please scan the green QR code or visit phmcresearch.org. Thank you so much for your time.